My name is William Palmer Jr. I'm one of the rehab physicians here at SciMed Health. So some of the conditions that we tend to treat with respect to chronic pain are low back pain, whether that's from a strain or discal problems like herniated disc or protruded disc, osteoarthritis, degenerative disc disease, spinal stenosis, foraminal stenosis, but also neck pain, headaches, shoulder pain, hip pain, knee pain, fibromyalgia, chronic regional pain syndrome or RSD, fractures in general, multiple surgery pain, cancer pain, shingles, repetitive stress injuries, really a whole host of pain conditions. Some of the effects of long-term chronic pain. Well, first you sometimes think about fear avoidance behavior, where patients fear doing an activity or moving an extremity that they feel is going to increase or exacerbate their pain, and then they avoid doing that particular activity. And as a result, sometimes you can lead to stiffness, you can lead to not doing your normal activities at home, which can lead to gait disturbance, postural difficulty, which may lead to the need for assistive devices. With that, you can start having some emotional difficulty, including anger, anxiety, depression, emotional lability, which could lead to some cognitive difficulty, like difficulty with their memory, difficulty with their concentration. But as well, with that, you can start using your medications or your narcotic medications excessively. You can start doctor shopping. You have insomnia. It can be a very difficult issue, because sometimes that patient thinks that people are not thinking it's real. So it can be very distressing. When I think about chronic pain, as a rehab physician here at SciMed, I think in terms of a multidisciplinary approach. And that multidisciplinary approach will definitely include the patient, obviously, but the pain specialist, many times a mental health specialist, which we do have here at SciMed, psychologists, and that also can be a psychiatrist. You have the physical therapist or occupational therapist, which we have here as well, and that'll be depending on which area of involvement there is on the body. And then you want to include the primary care physician as well. So if everybody is invested in the rehabilitation program, you have better success. And then I think of pain, or tackling pain, in a four-pronged approach, where I think about medications, therapy, injections, and at the last resort, surgery. Different types of pain are treated differently. Again, you think about acute pain, and that you may start thinking about, again, medication. You may think about therapy. You may kind of think about injections, maybe not as early. And then with chronic pain, you have the same type of things that you do, but it just may happen at a later point. And then, you got the bursitis and tendonitis. Again, you may look at injections or topical medications. You also have the neuropathic pain, where you may use specific types of medications. Then you have the spasticity, which may require another type of medication. And then again, you have the discal or vertebral issues, which may be a different approach in terms of back injections or the different type of back injections, epidural steroid injections or facet injections. So yeah, you can approach each particular type of pain in a particular fashion. Well, traditionally, we see patients on the back end of their pain complaints or their pain continuum. Ideally, it would be nice if we see them early on, because then maybe we can help prevent that pain progressing to chronic pain, which is, pain that is lasting 6 months or greater. And with those patients where the pain is lasting for long periods of time, and if they were working, it's less likely they'll get back to work. So we like to see them as early as possible, but of course, we'll see them along whatever pain continuum they are at. So, unfortunately, pain is a particular problem in our country, and low back pain is probably the most common pain syndrome and one of the more common reasons why people seek emergency room care. So it's not to be discounted. So we are here at SciMed, where we have that continuum of care in terms of primary care. We have the pain specialists, we have interventional pain physicians that deal with the injection aspect, and then we also have mental health professionals in terms of psychologists and psychiatrists that can help along with the pain syndrome.